Hello, welcome to Dear Dr. Mao, every Mondays at 5 p.m. Pacific Standard Time. Today's topic is preventing vector-borne disease, or VBD, which includes Lyme disease, dengue fever, and Zika. The beginning of summer means the start of exciting outdoor adventures for many people. However, we all need to be aware that bites from some insects can turn a dream adventure into a nightmare. Illness from tick, mosquito, and flea bites has more than tripled in the U.S. over the last decade. Diseases transmitted through the bites of blood-feeding insects are called vector-borne disease, therefore VBDs. They include Lyme disease, dengue fever, West Nile virus, Zika virus, and plague, to name a few, and are rapidly becoming a growing public health problem in the U.S. according to the CDC. VBDs account for more than 17% of all infectious diseases, resulting in more than 700,000 deaths each year globally, according to the World Health Organization. Symptoms of VBDs may include chills, fever, skin rash, headache, fatigue, and flu-like symptoms. Even after the initial symptoms from the infection abate, it can take up to 3 months or more to feel normal again. For instance, people with Lyme disease can develop severe arthritic pain, fatigue, and/or other symptoms such as cognitive decline that can last for years if left untreated. Of all the VBDs, tick-borne infections such as Lyme accounted for 75% of reported cases between 2004 and 2016, according to CDC statistics. Researchers speculate that the increase in VBDs may be due to climate warming, extending both the length of season and geographic areas, or in other words, when and where insects are active, as well as the rapid movement of goods and people around the world, distributing the eggs of infected mosquitoes far and wide. So, how can you then protect yourself and your loved ones against VBDs? What do you do if you or someone you know contracts Lyme disease or another VBD? What are the integrative treatment options that employ Eastern and Western medicine? Here are some prevention and treatment suggestions. First, research any area you're traveling to on the CDC website to assess the risk of VBD outbreaks. For example, the East Coast is a mess. Second, use DEET-free bug repellents containing lavender, citronelle, and mugwort when spending time in nature or visiting hot and humid places known for mosquito infestations. Try our natural flea and insect topical repellents, safe for both animals and humans, by visiting herbalpetcare.org. 3. Take B vitamins and garlic capsules starting at least 1 week before you leave home and continue taking them while traveling. This makes your blood very undesirable. 4. Take herbs that help support your immune system's antiviral and antibacterial defenses, herbs such as honeysuckle, sciller, and white mulberry. These and other herbs can be found in our metal element formula at dowstar.com. 5. Keep your immune system strong before, during, and after your travels, or spending time in nature by getting plenty of sleep, eating well, and exercising regularly, just as you are away from home. If you do get bitten and come down with symptoms of VBD, our practitioners at Dow Wellness use both conventional and traditional diagnostic tests, including blood, urine, stool, and imaging, as well as tongue, pulse, and physical exams to determine a diagnosis. When we have successfully treated patients with Lyme disease with a specific protocol of acupuncture, herbal, and nutritional regimens to combat the primary infection as well as co-infections, please call our offices and ask to speak to one of our doctors about diagnosis and treatment if you or someone you know might be infected with a VBD. Play safe and stay healthy when visiting the great outdoors. Look at where I am right now. Next week, join me as I discuss why this is a good time for reset and how to discover and reaffirm your purpose. Until then, live long, live strong, and live happy.